I also have Dr. Shekhar C Mande. He's the Director General of CSIR and Secretary DSIR. Thank you so much, Dr. Mande. Before I come to you, let's quickly show these graphics on screen on what certain scientists seem to be claiming. There is a claim by 239 scientists globally. Let's put those graphics on screen. These scientists are from 32 countries. They've written to the World Health Organization saying that there is evidence that smaller airborne particles can infect people, and scientists have asked the WHO to revise recommendations, and the source of this information is the New York Times. But Dr. Mande, this essentially says that this virus can travel in the air as well. Smaller particles can be in the air. So even if you don't come into direct contact with someone, say for instance, if you don't wear your mask, you can contract this virus. What's your assessment?
That's right. That's the claim that has been made by these 239 scientists. See, all of us agree that the principal route of infection is through our respiration. When we breathe in air and breathe out, that is the principal route of infection. Now, when an infected person coughs, that person emits aerosols, and those aerosols are typically big in size, something like 10 microns or larger. A micron is 1,000th of a millimeter. However, there is an increasing evidence that is being presented that the aerosols that are also generated while speaking, normal speaking like this, are the smaller aerosols, which are smaller than 5 micron size. Now, the Stokes law suggests that the larger aerosols will settle down on surfaces quickly, while the smaller aerosols will remain suspended in air for a longer time. That's the Stokes law. Both the larger as well as smaller aerosols can have entrapped virions in them, the virus particles in them, and therefore both can be infective. Now, all these days WHO has said that the larger aerosols which have settled on the surfaces, and if an uninfected person touches that surface, that actually could get transferred to that particular person, and eventually person either pokes the nose or puts a finger in the mouth, it might get affected. That's why the recommendation of washing hand with soap again and again. However, the mounting evidence, principally two papers in the Proceedings of National Academy of Sciences USA recently, have suggested that a speaking aerosol, the smaller in size aerosols, also contain entrapped virus, and they are a potential source of infection. And that's the evidence that these 239 scientists have pointed. And they also have written a paper in Emerging Infectious Diseases to support their claim.
So you see some credence in what they're trying to say, because you explained in great detail. You feel this needs to be studied further? Because if this is the case, then this challenges conventional wisdom about this virus and its spread.
Well, conventional wisdom is a very big word in this case, because we are just learning about the virus.
Correct.
The pandemic has been upon us only for less than 6 months.
I agree.
But indeed, yes, I mean, what the current understanding would tilting towards is that it is also spread by aerosols which are smaller in size, and therefore the recommended practice these 239 people have said would be wearing masks. That is an effective way of stopping that.
All right, Dr. Shekhar C Mande, thank you so much for joining us and explaining in great detail what these scientists seem to be claiming and what needs to be done with this information. Thank you so much.